All right. Good morning.
Thanks.
I am excited to be here today with Padma Sastry. Today, we're going to talk a lot about the current shift that's happening across the healthcare system and adopting AI tools to help with a number of things operationally, operational efficiency, provider satisfaction, patient satisfaction. Really lucky here today to be joined by Padma Sastry. She is the Chief Information Officer at Lowell Community Health Center, and she is going to guide us through some of her experience in real life implementations. How did her health center make these decisions on what solutions to adopt and what was the process? And these are questions that we're really hearing clients ask. Where do you get started? How do you decide, what's the best solution? What pieces do I need? What even questions do I have that I don't know, right? And Padma has done this successfully with her team at Lowell. So really excited to get some of her insight on today's discussion. So just a little introduction into who Padma is. So she spent decades in the healthcare informatics space, working across both hospital and ambulatory settings. She's a dentist by education, but expanded her career into digital transformation with a focus on advancing innovation, specifically in public health. She's a leading voice in technology and innovation and care delivery across the FQHC space, and we're really excited to be talking to that audience today. So welcome, Padma.
Thank you so much, Lisa.
So as we just started kicking off, we know there's so much buzz about various AI solutions in healthcare right now. So I would love it if you would just share with everyone, how did you and your team begin to decide on what were your priorities? What did that direction look like for your health center at Lowell?
Thank you for inviting me to the webinar. It's a pleasure to be here and share our journey here at Lowell Community Health Center. Just a little bit of background. Lowell Community Health Center is in Lowell, Massachusetts. We serve about 35,000 patients across the city of Lowell and also expanded the greater Lowell area. Majority of our patients are underserved. We provide not just healthcare services, but also extending it to specialty as well as social determinants of health services, community health services, and those kind of things. So just setting the stage for that. So the question that you asked is very timely. And sometimes when I think about that, we've been running healthcare operations, every health center, as well as every healthcare organization, if you think about it. It's not like one day we realize that, oh, we have all these operational challenges. Let's sit down and fix them all. We've been trying to do this for some time now. But now with the introduction of AI, we have an opportunity to take a step back and think, how can we do this differently? Can we do it better? Are some of our processes that we have said that, oh, we have done this for 50 years? Is that the right approach? So that kind of started the whole conversation about let's look at some of the pain points that we've historically had, but now we have an opportunity to look at it differently. So we always start with our mission. Our mission is to always provide the best access to our patients, a huge multilingual patient community, as well as staff that are engaged every day in providing the best healthcare possible to our patients. Our biggest challenge after most organizations after coming out from COVID, we've all pivoted to a different style of operating, and then now coming out of it, we all were presented with more challenges to deal with. That's nonstop for any organization. So what do we do if we say we want to conquer all, we want to tackle every single problem? I want to make sure our providers are working productively and efficiently with, staff burnout, as well as the best access to our patients, quality care, and also revenue optimization. So what we focused on is what are some real pain points? What are some real operational challenges that we need to tackle? And operational efficiency in terms of patient access, provider productivity and reducing burnout, and revenue optimization and language access. We landed on those themes that historically have been a challenge for all of us to wrap our arms around it and trying to come up with some unique solutions given the complexity that's around it. So my goal was, why does it have to be this complex? Why can't we simplify this? So if we were to start somewhere, we said, okay, let's start small, demonstrate value, and then scale. That has been our approach. And then whether it's AI or some other technology, the key has to always been the impact it has on our patients and it has on our staff. Once we have those guardrails and a strategy, we look at anything as a tool that will have to deliver on XYZ, whether it's AI or, something else. So that's kind of how it's been our approach towards that.
You made so many good comments there, right? The problems that we're trying to solve, these are not new problems in healthcare, not new problems in FQHCs, right? These have been problems that we've been looking at different ways. COVID certainly changed that lens, right? And forced us to make some real quick changes overnight in most cases. But now we do have this really unique opportunity to employ these tools they're very different than some of the solutions we've had before. So I do applaud you and your team for saying, let's not say, here's how we've been doing it for 50 years, but instead, is there a way that we can start to adopt some of these things, can really accelerate those improvements? So I think that's excellent. Is in my experience as, because I am a product owner and a vendor, right? I'm working directly with clients. And those conversations, we're more talking about, their specific pain point or use case, and how to use these tools to address that. But I think because you are located in a health center, you have a much more holistic view. And so I would be interested in how, as you guys were starting on this journey, how did you think about those foundational governance pieces that you really wanted to build into that framework to ensure that you were adopting these different tools responsibly and safely? So can you share some key pieces of wisdom about that part of the puzzle?
Yes, that's an excellent question. Back in 2020, when we were presented with the exact same challenges that we are presented with every single year. And at that time, it was AI was just coming into conversation. Everybody was a little skeptical, but we're like, oh, what is this thing, AI, that is coming into healthcare? And people are talking that it's going to change the way we do our work. And there's just a lot of skepticism. Is that going to replace the human being? And all of that confusion. So we took a step back and said, okay, whether or not it is, again, whether it's this tool or some other tool, ultimately we need to know what problem are we trying to solve here, right? That's the first thing that comes to mind. So what problem do we want to solve with by using this tool? It really needs to augment what are doing by not just simply black box automation, right? So when you come up with that type of a guiding principle and you have a North Star saying, we want to achieve a better patient access that is going to provide us with the same or sometimes even better patient experience. We want to provide our tools to our physicians and our nurse practitioners, our nurses, our clinicians, where they could actually streamline their work and cut down the after hours work, or so-called the pajama time. And historically, all of us have had, manual work that we have to do in terms of, the administrative work that has to do with revenue optimization. There's a process for making things not too cost prohibitive for us. So these are all realities that we had to deal with. So setting that guiding principle and saying, what are our key priorities? What are some problems that we're trying to solve? And let's start to look at it differently. So you have to set up that governance structure. And that is not just a top down saying we have all these 5 things we want to do this year, but to actually go down and talk to the staff, the frontline staff, to look at how they're doing their work. And then how do we make this process more simpler? There will be tools that promise you that they are going to give you X, Y, and Z, but when you actually do the workflow analysis, it's going to add more steps to it rather than eliminate some of the manual work. So we have to be very careful in terms of what we introduce into our ecosystem that is not going to create an extra burden for our staff just by, just giving it the name of AI and technology. We don't want to add more steps to our staff. We want to alleviate some of the work and offload some of the manual and the duplication for them. So that was kind of the guiding principles. We have set up our own operational committee, steering committee, if you will, where it's cross-functional, cross-team represented, both clinical administrative staff. Pretty much majority of our leaders in our organization are very much in the weeds. So they can actually talk to some of the things that are going well for us and things that are not going well for us by using technology. So that was kind of our way to level set what is it that we want to tackle right now.
Right. And I think, so important, defining the problem to solve, right? And really evaluating that workflow, right? Is it going to improve it, or is it going to potentially make it more complex? Because anyone who's worked in healthcare for any time has seen the latter, unfortunately. But I think that was a really strategic approach to, engage your key stakeholders and really get the input from, bottom up, top down, and make sure everybody has been part of that conversation. As we're working with clients with provider tech, we have seen some really exciting results come out of the implementations, right? So our clients are predominantly using agentic AI in their inbound call centers. So we've seen really exciting things like 40% reduction in abandonment rate in the call center, right? Having managed a call center before, that's really exciting for me. Virtually no wait times, being handled end to end. Over 70% of calls being handled end to end by the AI agent after 90 days of implementation. So I'm wondering if you could share with everyone, what are some of the key use cases and those outcomes from the initial pilots, really just to let people see, here's how it actually looks like, and here's what success looks like in a health center.
Yes. So call center optimization is a real challenge for every organization. One of the challenges that are presented with the FQHCs is that we have to provide access, not just in one language, we have to provide access in multiple languages, right? So that will add a little bit of complexity, but we wanted to take that challenge on because our number one goal is to make sure patient access is delivered in the same lines as any other big organization that's out there. So we want to make access as easy as possible, remove the complexity of it, because language, it creates a complexity, but at the same time, when you figure out ways to kind of remove the complexity out of it, it makes things so much easier for our patients and for our providers. So that is something we tackled. So we used an AI solution called Attuned AI that we've implemented initially. We piloted it with our call center for after hours support, so that we were trying to balance it with the business hours as well as the after hours, and also want to make sure that how is this being received by our providers who are on call versus how is this being received by our patients. So we piloted it with our after hours answering service. We had AI start taking all of those calls. And then it was very interesting the kind of information we were able to discover with the data that was now starting to be coming to us, which we'd never had before. So once we started rolling it out to the after hour services and started to see what type of phone calls do we get during after hours from our patients. Majority of the time, it's a patient who's trying to ask for information, which typically needs to be called during business hours, because we're not a 24/7 like a hospital. We have certain business hours. So the AI was easily able to at least provide that guidance to the patient, say, please call back during business hours. And that just reassurance and say somebody's actually giving me some instruction on what to do versus just directly passing it on to the answering service, who may have their experience in answering these type of questions, but why send the patient all the way through all those hoops? And then again, why, if we can answer those questions, then having to page the provider and having them call only to find out that this has to be addressed during the business hours. So through that, we identified a lot of these workflows that we've had for ages and ages, where we realized, okay, there's a simpler way to do this, and this is going to not just help our patients, it's also going to help our providers. Once we looked at that whole process, we said, okay, let's scale it to business hours, and we started doing it incrementally for a couple of hours initially, and then extending it to 2, 3, 4 hours. And then, like your experience working with other organizations, the results were pretty evident. We saw about a really high engagement rate with our patients, trying to see, well, now I don't really have to be on hold for 1 hour, which is reality when you look at the volume that comes in through a typical call center. So now the AI is now able to handle all our business hours, initial interaction with our patients, and then the AI is able to answer some of those questions, basic questions that it can be answered. And again, we were taking a very conservative approach to this. While it has lots of capabilities, we were like a crawl, walk, run, just so we want to make sure that the experience for our staff and the patients was good. And the results were around the abandonment rate. We start to monitor our abandonment rate, which historically was really kind of high for us, given the volume. And typical FQHCs, we can't always have 50, 60, 70 call center agents. We're small organizations and we're spread thin. So we have to maximize our staffing. Call abandonment rate, and then how we were able to triage. Again, during the business hours, the key is, even before I emphasize on the outcome and the results of it, I want to emphasize more on what was the information we didn't previously have that we now have, because of the data that the AI is providing to us. What are the top 5 reasons our patients are calling us for? And medication refills, lab results, scheduling, and some of these are like, I need to speak to my doctor about an upcoming appointment. We looked at that information. That data was pretty compelling to look at, say, wow, we now have a way to streamline this information and make sure that these patients can actually talk to somebody who can answer that question and then resolve it on the spot. And now you got to take the next step to say, now, how can we automate this? We started to think about, okay, now we have to think about how do we integrate this within our electronic medical record workflows, so that our staff don't have to just constantly create these communications to say, patient call for XYZ, patient call for XYZ. Rather, the AI is taking that information and creating that communication where it needs to go to, and our call center staff are addressing the most complex needs of our patients who are calling and want to reach a live agent over the phone.
I think that's, certainly the most common way to evaluate it is looking at those metrics that we look at. But I think what you guys did to really look at that data, right? And what are these common calls? And, we've all had the experience, whether in healthcare or in other industries, where you have to ask your question or tell your story about why you're calling a million times to get to the right person and to get it resolved. Right. And so by having that information and tweaking workflows and then building the automation around it is really impactful for, both your staff to not have to maybe handle some of those things that could be a simple resolution, but also for your patients to get to the right person when it is a more complex need. So really that's a really strong way to use those tools, to leverage those tools. As we're wrapping up today, I want to just highlight a few of the key takeaways and ask if there's any other, last pieces of wisdom that you'd like to share with other FQHCs that are embarking on this journey or maybe in the early stages. So I think some of the things that I heard you say that really stand out is really that importance of first defining the problem, right? There's so many really sexy new tools out there that, you see a demo and it's exciting, but, as you guys did, sitting down with your team and understanding these are our priorities and really there's all these problems, but how do we prioritize that? So engaging the key stakeholders from both executive leadership, operations, frontline staff, really pivotal to define that priority use case or use cases. You talked about creating a governance around the AI solutions and the steering committee and your team being able to, really to be in the weeds and understand how this is going and really building that in as an initial step. As we just talked about, evaluating the data that the tools are giving you and and how to leverage that to really improve the whole workflow, whether it's related to the optimizing the AI, but just creating the workflow and then being able to, accelerate it with automation. And I think one of the really like very simple things you said, but I think have a profound impact of the reason you guys have been able to bring in multiple pilot use cases now is how you have approached it, right? Start small, measure success, and then scale from there, right? Not trying to boil the ocean, but taking that one facet of it, starting it after hours, and then expanding it to a few hours during the day, and on and on. I think that's really a great guiding principle for other FQHCs. So other than those key takeaways, is there any last nuggets of wisdom you want to share with the group?
I think you captured all of this so wonderfully, even better than how I may have articulated. So if there's one more thing that I would say is that it's definitely a culture shift for a lot of our organizations, where all of these news around AI and a day doesn't go by where there isn't another new tool that's out there and it can do X, Y, and Z. But as an organization, by way of culture, what I mean is you do have to create this sense of digital curiosity, and also try to create this appetite for innovation. Being innovative isn't new for health centers. We have been doing this for decades because the need always drives the innovation. So we have the chops to do this. We have done it again and again and again. But now we have a unique opportunity to leverage some new tools to look at things differently. So from a culture shift and a change management standpoint, this is going to be huge for some of the leaders that are going into this thinking, what am I with some of the problems that I have? So that's what I would say as something, and we are still learning. We are still improving. We have multiple other challenges to tackle, but we are confident that through our approach, to our framework, we will achieve our goals.
I think that's a digital curiosity. I really like that, instilling that digital curiosity in your culture. I think that's fantastic. And you're right, FQHCs have had to be innovative always, right? And we're at a really unique time. I won't say the most unique time because we've seen a lot of unique times in the history of FQHCs, but it does definitely demand looking at things differently. So I want to thank you so much for your time and insights shared, and really helping share those the learnings along the way. It's a really exciting time in healthcare, but sometimes that can make people feel a little bit nervous and apprehensive. Sharing those insights, I think will be really profound for others that are on this journey. So thank you so much for that. I do want to just close today with anyone who is watching this. FASTx Partners is helping health centers do a lot of the groundwork that Padma just described. Right? We have fractional services that can really help organizations through that initial exploration of their current status, building out that governance, helping prioritize use cases, simple roadmaps, all the way to implementation. Wherever you are in that journey, if you need some help, certainly you can reach out to FASTx Partners directly. The website is just fastxpartners.com. And you can find out more information how to contact the team from there. But thank you all today for your time and for joining us. And Padma, again, thank you so much and have a wonderful day.
Thank you, Lisa. Bye.
Bye.